Yes. So Vasundhara, you can just give a countdown, 3, 2, 1, and you can begin then. We've
Okay.
started the recording.
3, 2, 1, go. Hello everyone. Here's welcoming you all to all new episode of our Health from Home series by Aditya Birla Health Insurance. Today we will discuss about a very critical and vital organ of our body, the heart. Our life has become so busy these days that while we are all chasing deadlines, fixing meetings, hitting the gym hard, and struggling to ensure healthy eating, we forget that it is sometimes important to take a step back and ask ourselves to listen to our heart. The vital organ pumps nutrient rich blood throughout your body and supplies oxygen to it while removing toxins and waste. Hence, you can understand how important it is to ensure that it is good health and no matter what you age. I think I missed the line. You want me to repeat the last para again? Or is it
If you
okay?
can take it from the top, Vasundhara,
Yeah,
please. That's good. Yeah.
sure.
Just 3, 2, 1, and you can start.
No
Great.
need. I think it doesn't look bad if you miss something. Nobody knows. So just carry on. Be natural. No issues.
Yes, yes.
Yeah. No need to
Thank you,
read out the
doctor.
whole thing. No need. You were
Thank
so nice. So nice. Yeah, you came out so
thank you,
nice.
doctor.
Yeah. Thank you.
Thank you, thank you.
Yeah.
Okay.
Yeah.
3, 2, 1, go. Hello everyone, here's welcoming you to all new episode of our Health from Home series by Aditya Birla Health Insurance. Today we will discuss about a very critical and vital organ of our body, the heart. Our life has become so busy these days that while we all are chasing deadlines, fixing meetings, hitting the gym hard, and struggling to ensure a healthy eating, we sometimes forget to take a step back and ask ourselves about, to listen to our heart. The vital organ pumps nutrient rich blood throughout your body and supplies oxygen to it while removing the toxins and waste. Hence, you can understand how important it is to ensure its good health no matter what your age is. World Heart Day is celebrated on September 29th every year, and in commemoration of this day, I, Vasundhara Agrawal, MSc in Clinical Nutrition and Dietetics, would like to welcome Dr. Hari Krishnan P, an MBBS MD in General Medicine, India, MD in Cardiovascular Medicine, UK, MRCP London, UK, holds a certificate of specialist training in cardiology intervention, Cambridge University. Dr. Hari Krishnan holds a vast experience of 25 plus years. He is also an author of various publications, both clinical and research. Today, he's going to educate us on importance of listening to your heart with our today's episode titled Ab Suno Dil Ki.
Hi, Vasundhara. It was so lovely. Good introduction. So, it is very vital to say that the heart is the important organ of the whole body. And if you actually look after the heart, then you essentially look after the whole body properly. And it's all interrelated, as we know. The whole body and the vasculature is like one tree with plenty of branches around, and it supplies from the head to the toe. So let's begin today, and you can shoot your questions to me. Thank you.
Great.
Yeah.
Doctor, we all know that embracing a healthy lifestyle at any age can prevent heart diseases and it may lower our risk of a heart attack or stroke. However, we have received so many questions from our viewers who would like to know more about their heart health. If I can start, Doctor.
Yeah, thank you. Go on.
Great. Doctor, can you please define what is good heart health for our viewers?
So good heart health is a combination of factors, as you know. First of all, I think from young age, we should look after the risk factors, which could potentially affect the heart health. For example, if you say obesity, the way we are eating, way we actually, do our lifestyle changes from the young age. Often we have a notion that all the precautions we can take after a certain age, we are young, we have to eat well, and you eat a lot of, things which are not good for the heart also. And young age, we can see even from school children, I think the obesity, hypertension, and heart health remains a concern because all the various estimates of obesity and things are getting higher and higher, especially with the blind copying of the Western lifestyle, in spite of us ingrained in the Indian culture, which is rich with tradition of yoga and eating healthy and eating local foods and things like that. Things are rapidly changing because of the modernization. And the other thing we have is looking at the risk factors right from the young age. We used to say old age is after 60. Now I would define old age after 45. I think because the average age of heart attack, 50% of people in India is before 45 years, we get a heart attack. So if you look at the statistics in India, it's staggering. We are nearly about 10 to 15 years younger when we get a heart attack, because the Asian population is very highly prone for heart diseases. So heart health includes when you are doing your routine things, not feeling any discomfort, you are healthy, you are breathing well, you don't get any undue tiredness. All these things show that we are healthy. At the same time, sometimes there could be silently brewing some risk factors like BP, sugar, cholesterol being risk factor. All these things, I think we have to have essential checkup.
Metabolic syndrome, basically.
Metabolic syndrome. All these things should be covered at an earlier age by means of undergoing preventive health checkups from the beginning. And so we can identify these things early and make sure we are really healthy. Outside we look very nice, outside we look very shiny, but that doesn't mean inside our health is good, and we have to make sure this is happening. That was a lovely question. Thank you.
Thank you, doctor. It was quite insightful, and you mentioned it right, that early diagnosis and treating early and starting off taking care of your body at the right time is extremely important. Doctor, could you also help us, like, what in our daily routine, in our daily habits, what can we inculcate to have a healthy heart?
So this is the essence of the talk today. So
yes,
daily changes in the lifestyle is the hardest to make. So when I tell people, try to do this, try to do that, people say, is there any medicine? Is there any pill? How should I lose weight? Is there any magic pill? So this doesn't come under with any medications. It's our responsibility to take care of our health. So you start off early. I would say start your day with good amount of exercise before you go to work, or whenever you start working. Before you go to work, get a good amount of exercise. Say the recommendations we'll talk about in the later questions, I would say, but we would have a detailed discussion about that. But do a good amount of exercise first, then eat healthy. So the morning, the breakfast, and don't skip breakfast. Lots of people tend to do that because they're in a hurry to get to work and they can have it later. So don't skip breakfast. Breakfast is the main meal. So is the lunch, and dinner should be very light. So that's another thing. Take enough rest. So don't keep on, browsing your mobile phones so now the mobile phones are the main evil for us, I think, actually. Unless you know how to really use it judiciously. It's like an encyclopedia. You can get all the information in it in a click of buttons, actually. So people are always, I go to my clinic room, and on the way I see everybody using one mobile phone, including children of aged 1 and 2, and people of age 70 to 80. All of them have a separate mobile phone. And I say, this is right, this is not right. You have to discuss amongst yourself. You have to have some communication. There's no communication going on. It's all virtual world we are living in. That should be taken care of. And eat healthy. So eating is not like a rush. It's not grabbing a bite on the way. So that is I can grab a coffee on the way to work. It's like a modern lifestyle. That's what I saw in Canada when I used to work. Grab a cup of coffee and a sandwich and just munch it whilst you're reading a newspaper in a busy train. How is that going to? You spend some good time in feeling the richness of the food we're eating. Eat healthy food, and you don't just order in a Swiggy, go on. So those things are getting there. Nobody knows how to cook these days properly. So people are that the only the grandmas are supposed to cook, or moms are supposed to cook. We are not supposed to cook now, modern lifestyle. So all these things should be taken care of. Yeah.
Totally agree, doctor. Like, I have been noticing during my diet consultation, I often hear that they don't want to eat breakfast, and wherein breakfast is like supposed to be eaten like a king. They are missing on that part. There are so many fad diets today, but the whole point is that's why we have started this series, so that we can educate our viewers to know that how small changes matters to improve your health at the right time. And I mentioned earlier, there is no right time. Whenever you want to start, just start with full heart.
Yeah,
Follow your good routine, and you will get there.
absolutely. Extremely
Yes,
nice. Yeah, well said.
yes.
Yeah.
And doctor, what are like common heart diseases, ailments, and how can we prevent them?
So as I told you, the common heart diseases, you should start off with the risk factors first. So risk factors, for example, diabetes is a cardiovascular disease. So you prevent metabolic syndrome, like you rightly to use the word, coined the word before. Metabolic syndrome is like head to foot. You look after your, the obesity part. You look after your blood pressure part, all your cholesterol part. These things
Cholesterol.
play. Yeah, these things are vital first. And so that is the main heart disease to start off with. Even though you don't relate, people think, sir, if you have BP, can I get a heart problem? If I have obesity, they are often disturbed when I just, when I go into my work, people draw their stomach inside so that I can't, hit them. Actually, when I say, what is this? All the security officers have a big punch when they go in. Actually, I usually go and just say,
Punch
like a
them.
friendly thing. Why do you have all these things? Nasser, why are you having this? Like that, actually. So what I tend to do is like encourage that from that beginning. So you make sure that you hit the right note from the beginning. So make sure you are actually leading a healthy lifestyle. That's first one. That's the main heart disease, I think, even before it starts. That's primary prevention
True.
of heart disease. And secondly, coronary artery disease would come. So when you start exercising at whatever age, you don't sit in one place. People often mistake exercise to going to the gym. It is not true. Actually, you can do it in your day-to-day routine. For example, you take the stairs. I never see people taking the stairs. People are all waiting
For
to
the
get into
lift.
the lift. Even though it's only first floor, there's a cardiac consultation. Even young people alike, compared to old people, they all do the same thing. So they don't want to get their, attitude, their attire to get sweaty. And often I think unless there is mud in your hands and sweat in your body, you're not really doing a proper cardiovascular problem, workout that day, actually. So you have to just start from the beginning. So that is very important, and make sure coronary artery disease doesn't strike us. Keep your arteries healthy. So when you move around, you precondition your heart. You precondition it to prevent a heart attack. Even if you have a little block, there'll be like collateral supply can form, and the blood supply, the width of the coronary arteries get bigger as we do more and more work. So for example, the Asians have a smaller body built. Actually, BMI is can be big, but the height and weight or the body, we are born with smaller arteries. When we work out more, the arteries get bigger to adapt to the necessity of the workout we have. So then the small block doesn't bother us, and it's preconditioned already. So coronary artery disease we can prevent. Congenital heart diseases or the common heart diseases also, but those need to be screened properly, and so we can identify them early and treat it. Diseases related to the bad habits like alcohol, like we can produce what we call cardiomyopathy. High blood pressure can produce cardiomyopathy. All these things need to be screened early. So all these things are common heart diseases. We have to target them at different levels. So primary prevention, one thing. Coronary artery disease is the next one, which we have to modify our lifestyle predominantly at a young age and look at the risk factors and correct them. And other secondary cardiomyopathies can be identified early and corrected. And things related to bad habits can also be identified and corrected. So all these things need to be targeted.
Great, doctor. It was quite knowledgeable, and you actually answered my next question a little bit already. I also wanted to know, like, what all activities would you suggest so that we can have a healthy heart? You mentioned it, right? Nobody uses the elevator. They don't
Uses
want
the
to sweat
elevator.
out.
Yeah,
Yeah,
nobody
yeah.
uses the stairs. Yeah, yeah, yeah,
Yes,
yeah, yeah,
yes. So
yeah.
sorry, you got me.
Yeah,
Nobody uses the stairs. People are just waiting for the elevator.
yeah, yeah.
So, what are the activities would you suggest to have a healthy heart?
Yeah, so the things are, lots of, even yesterday I saw a forward in the WhatsApp telling that don't work out. don't go for trekking. Don't all these things. People who don't want to exercise can, for example, there is also a wrong notion about cholesterol. So ghee has good cholesterol. Egg, yellow of the egg is very good for us.
Yes,
Lots of these things. As a nutritionist, I'm sure you are actually
it
always
is. I have a
challenged.
tough time.
Yeah, so the statins, for example, there is a lobby to support statins. There is a lobby to go exactly against the exact notion of statins. I know there is ulterior motive with all these things. Certain lobbies are favoring fatty things. Certain lobbies don't want fatty things, and that's where the even NEJM has contradicting articles regarding all these. So when you look at exercises, all we should do is moderate intensity of exercise, which is the best for us, like gentle jog, swim, cycle at your own pace, and also brisk walking for elder people. All these things could be tailored for around at least 150 minutes per week. That comes to around 20 minutes to 30 minutes a day. And also there is an additional recommendation for a little bit muscle strengthening on toning up type of exercises at least twice a week. So the bulk of muscles help in carrying the oxygen for us when we need it, and we will not get puffed up when we are walking upstairs, for example. The muscles carry those oxygen what we need. So whenever I see a person who is just flappy everywhere, just hanging around, so all the muscles are not there, non-existent, only fat covering the whole body.
Yeah,
Then I
it's
often
just fat
tell,
mass. Yes.
yeah, where is the oxygen carrying capacity in this body? People are often wondering why I got a heart attack, sir. I've been following, I don't have any bad habits, but I say, you actually reap what you sow. Actually, what's the foundation you have made? Have you done any homework to help your body? What was your aim in life? Aim was to become a doctor. And after that, what? Build a house. After that, get a BMW. Where is the aim for having a healthy heart in your, routine life, for example?
Exactly.
So there is no aim and there's no foundation made, and you reap what you sow, actually. So that's where it lies, actually. So that's the amount of exercise we should do.
Actually, I think people are missing the health is wealth.
Yeah.
So we are compromising on our health every day just to earn the wealth. We are skipping our breakfast, we're skipping a healthy routine, we're just running behind our errands that, okay, we have to just get done with this day. We have to do this. But nobody's concentrating on our health. And like doctor, like you mentioned that, nobody is keen on doing exercise or anything. They say that we don't have any bad habits. So what is leading to heart attack? So can you briefly explain us what exactly is bad lifestyle or stress? How does this affect our heart health? So and what all are the categories of bad habits, bad lifestyle? I want this to be a little more precise.
Yeah. See, it actually starts at a very young age. I think lack of activity is the basic thing in Indian lifestyle. I think so. People just sit and don't move. Yeah. So if you want a glass of water, you ask your wife, can I have a glass of water? Mom, can I have a drink? Mom, can you clear the table? So mom does everything for you, actually. So that's the basic thing to start off with. And moms are happy doing it. Like
exactly.
In the UK or in where I used to work, North America, they say, you lazy bugger, go and start and get moving, do it yourself, actually. So here moms are happy if they were asked to
they
do
don't want to push anything on their son or daughter. It's not just son, anybody, no gender specific, whether it's daughter or son. They don't want to push them to do any extra activity at home.
Yeah. And the other thing is like, I would say the way you eat is very important. I think if you're young, you're supposed to eat a lot of, bad things. For example, ghee is okay, a lot of rice is okay. So carbohydrate should be reduced. As a nutritionist, I think you'll be expert in doing this. And
no, I don't agree on reducing carbohydrate at all.
Yeah, but carbohydrate, the amount of portions we eat is very high. I think rich, fat. Like people go on diet where paleo diet is there. You eat a lot of fat, reduce a lot of that sort of things. We are not talking about. We're talking about moderate amount of carbohydrates. At the same time, add a lot of good proteins in your diet. Add healthy fat in your diet. It has to be a balanced food. Like that's what I advise my people. The other thing is like lifestyle changes include smoking and drinking. I think smoking one is too many. So we'll talk about smoking in detail in the next few sessions. But smoking completely avoid smoking. Drinking again, even if I say moderate amount of drinking is good, then it translate into people don't follow the norm. So I would tend to say don't drink. So it might be the best way to do it, because if I say, then people just often overshoot the moderate amount. They don't stick on to the healthy things like wine. They go on to brandy, whiskey, which is all very high content of alcohol, and 1 unit is only 20 ml of those things. And if I advise 2 to 3 units per person, nobody is going to stop with the 40 ml of whiskey per day or whatever actually. So that's never going to be a healthy drink. So people always overshoot it. So I tell don't drink, might be the best way to do. And eating healthy, taking plenty of exercises, taking good care of what you're eating. Like in the bad habit side, I think you try to avoid alcohol and smoking. So these things, if you commonly follow, then that's a good lifestyle. Actually, it's very simple also.
Doctor, I would like to add one more point to this bad lifestyle. I think along with smoking and drinking, we should also add bad eating habits. The junk eating, the consumption of packaged foods. I think we should start including this in the bad habits and bad lifestyle, because
absolutely,
people think that okay, it's just chips, okay, it's just pizza, it's okay, I have to treat my child, it's his party, I have to give him, but they're not understanding what this party is going to lead in the future.
Absolutely, 100%.
So in fact, like next question is actually upon food, like which foods should be provided to a person who's already dealing with a heart ailment, like what diet he should be following as per you?
So what I would suggest is like avoiding things like sugary items, avoiding things like carbonated items, soda and all these things, avoiding red meat, avoiding processed food. And avoiding too much of carbohydrates. Actually, in Indian setting, I think you eat a lot of rice. Rice is the main thing. So if you look at a common plate, one bucket full of rice they will bring and put like a mountain, and then you have vegetables in a small spoon they will serve. You have to reverse that. So you eat lots of green vegetables, lots of fruits, but less rice along with that. So it will so basically you are actually eating foods which are low in the glycemic index, and you basically they slowly digest and produce that satiety and don't lead on to a yo-yo of sugar levels in the body. And that actually turns the thing around actually. So by doing that, you lessen your triglyceride levels, you lessen your the spikes of sugar levels, you lessen your chances of obesity, you lessen the level of the vascular injury it produces. All these things, the bad radicals, free radicals released from the body, all these things go and affect your endothelial system, and all these things you are actually essentially trying to cut down. And also eating like this makes your mood stable also. You don't get a sudden high and sudden low depression. Then you actually are sleeping better. You don't eat late also. You eat a little bit early so that you have a little walk before you sleep, and you make your, so people often eat rice in the night time so that they can sleep well, so that the digestion is very much slow at night time. And that's the starting point for all the problems in the life actually. So you don't eat rice in the night time a big quantity, and that is a major issue, because people don't have time during the day. They are rushing around, and the night time is the time they can spend with their family. They come home late, the wife is waiting for them, and then our husband is waiting, and they all both have a big meal as a happy meal before they sleep. And it's actually the starting point for all the problems in life.
Yeah, so it's going the other way around. Like breakfast should be the bigger meal and dinner should be the, smaller meal.
Yeah,
But
yeah,
in my practice, I often hear that breakfast I had one slice of bread, or I
yeah,
just had one cup of tea.
yeah,
Lunch I had sabzi roti, but dinner I had like a grand dinner. I had
yeah,
sabzi, I had roti, I had dal, I had chaach, I had this,
yes,
I had that.
yeah.
I'm like, no, that's not the way you have to go about.
Yeah, absolutely.
So, yeah, we need to change the eating pattern and the eating timing, like, to follow what our ancients used to follow, what our forefathers are following, and they
Yeah,
had a healthier life. And plus, like you mentioned, the heart attack risk rate, like the age has come to 45. Earlier, it was 60 and above. It's
yeah,
all because of this eating and sleeping habit.
absolutely, absolutely.
Yes. Doctor, so how smoking and consumption of alcohol are actually related to heart ailments? Like food, we know, but what about smoking and drinking?
So smoking is, I think, one is too many. I would say stop smoking. So basically, any society, you have 30 to 40% of people who are smoking. Abroad, it is men and women alike smoke. So if women smoke, the risk is even higher compared to men because of the way their nature is. They made with lots of hormones. So which again they lose that protection once they reach their menopause, and the risk is very high after that. So I think
Correct.
men and women are like, especially pregnant ladies, I see lots of them smoking abroad. So it was a
Oh,
major problem. So smoking doubles our at least 2 to 3 times higher heart attack risk if you stop smoking. Again, within 4 years, you come to a non-smoker's risk more or less. So
okay.
those things you have to be mindful about. So smoking, as you know, produces nicotine in the body. Nicotine is a vasoconstrictor. That means it shrinks the blood supply and makes the arteries or coronary arteries prone for blocks inside, or plaque development of atherosclerotic plaque is higher when you keep smoking. And
Okay.
the other method it does it is by producing carbon monoxide in the blood. And carbon monoxide doesn't allow the oxygen to be in the blood, it replaces it, and that leads on to ischemia, or lack of blood supply in the heart muscle, and leads on to heart attacks. That's two. And the smokers have changes in the blood. The different cells in the blood, platelet cells, are more prone for clotting. They form more clots, and often I see a big artery with a big clot in a young smoker coming out with a heart attack. They make the blood more prone for clotting, so the cell count is more stickier, and that makes it clot prone. And the other method is like the endothelial function gets affected. The smoker's arteries, the nitric oxide is a vasodilator, it relaxes the blood supply, and the smokers have less nitric oxide protection. So whenever you have more stress hormones, more sympathetic drive is also higher, the heart rate is higher with smokers, and the blood pressure temporarily is going high also. So all these things make a smoker more prone for heart attacks, and the longer term effects of heart attack like cardiomyopathy, because heart gets silently damaged and get enlarged heart and damaged heart in the longer term. So all these things are smokers also have peripheral vascular disease, like they have blockages to the whole vascular system, especially to the peripheral, like the leg arteries. When they walk, they get claudication pain. That means like they can't walk for a certain distance and they have to stop before they have to restart walking. Now all these things make smokers more important to stop smoking, which is comes around attributable risk of nearly 30% of all the heart attacks we have. 20 to 30% is attributed to a smoker, having a smoke. So that is one thing. Alcohol in moderation is said to be good, but there is no real randomized control trials. And so I would advise everybody not to drink alcohol. That would be prime for it. And the second thing is like alcoholic cardiomyopathy is it's a direct toxin to the heart's muscle and make the heart muscle bulge. And so it has other effects on cholesterol levels, triglycerides go up, liver diseases can occur. Alcohol is a direct toxin to lots of parts in the body. So I would say alcohol, even in moderation, should be avoided in Indian setting. And so no smoke, no alcohol would be my tea.
Got it, doctor. Doctor, so like even like when people say one glass of red wine is good for heart, So, is this true? Like,
So there
what
is evidence to moderate amount of drinking, especially with the amount of units we take. If it is less, especially with red wine, people, especially in the Mediterranean region, eats drink red wine along with fish, and there is some
Hmm.
evidence to say that that has been beneficial. But I don't see anybody drinking red wine in India.
People do drink, but then they don't stop. I think
Yeah,
the
yeah,
quantity, like the units, what you mentioned, matters.
yeah,
And actually, the weather in India is not good enough for like consumption of wine, but still, I think the units is something what matters the
yeah,
most.
yeah.
And
But if you tell anybody, I have been asked in lots of bigger forums, like in a bigger meetings, doctor, can I drink? I'll say, don't drink because it will carry on. My doctor told drinking. Next landing he will have is in a wine shop, and
exactly,
I'll be caught actually because I'll be quoted there.
yeah, because doctor said you can have one glass,
Yeah, yeah,
but
and
and
it
that's why
never
I'm
stops.
here.
It never stops. It never stops after that. Yeah.
Yes,
Mm.
yes. So it's like a big no-no. Doctor, also, we are seeing that a lot of youngsters, especially people who are hitting their 30s, are being affected with their heart conditions, heart attacks. What's your point of view on this? Like,
Yeah.
why is this happening at this particular age? There's so many uh, people who are getting affected with heart attacks at that particular age.
So average age of heart attack is nearly in his 40s to 50s in India on different databases we have, and 50% of heart attacks occur before we reach 50 in India, and it is a very staggering figure because you imagine a person of 45 having a heart attack, how much of loss he produces to his family. So he's looking after his children, he's looking after his father and mother, and he's probably the prime of his life around 45, and just imagine how much loss he can produce by heart attacks. Also we have mortality along with that. So that is what we are aiming for, and the problem is we are aiming to prevent this very staggering figure or lessen it by modifying your lifestyle. 45, then what age you have to start off? I would say when you're just starting off, coming out of your mother's tummy.
Yes,
So when you start drinking milk first, I think you have to start off in a healthy lifestyle. So that is when we have to start, and right from schooling. And children now are addicted to mobile phones, and this is what my major
yes,
problem is now.
yes.
So yesterday I was a big conversation with one of my patients who is in her 30s, and the major issue she's having is to control her son, to prevent him playing games. Somewhere the password is broken, somehow her password has her phone is stolen, and then
Oh,
and then he uses her mobile phone to play games, and
oh.
she can't control it, and she's having heart problems because of her son.
Oh my God, that's
Yeah,
like
yeah. So
that's the worst
that
thing.
is a very very sad state of affairs. I think people can be bright, and they can manipulate people from a young age to modify the way they want to do, and they have a plan. They are already planning when they come out of school what game they are playing, and they are addicted with that. And
Exactly.
it's peer pressure, and if he's not logging on today, he'll have pressure from his peers tomorrow.
Discussion.
Yeah, yeah.
Yes,
So that is a big problem now, and people are not getting supervised properly, and people don't know how to people are cry. So babies cry, and the one way mothers can pacify them is to give a mobile phone
give the mobile.
and then feed the baby.
That's, I think, the worst thing
Yeah,
I see. And
yeah,
I don't know, I'm not a mother yet, so I
yeah,
don't want to comment how hard it is on mothers also
yeah, yeah,
to manage everything, because the entire load comes
yeah,
on the women,
yeah,
whether she's working
yeah,
or she's a housewife.
yeah,
So it becomes difficult for the mothers also to manage the
yeah,
children, because there's so much exposure today. It
yeah,
is extremely difficult to keep your children away from these gadgets and give a good
yeah,
parenting, and
yeah,
keep your children healthy right from the beginning, how to
yeah,
give good nutrition, how to nurture them, good
yeah,
imbibe good values. It is
yeah,
too much a challenge, but I think small steps at a time can help them achieve this
So
goal.
this is when joint family helps actually. People are away from
I
that also.
agree.
It's
I
nuclear,
agree.
the nuclear families now. People want to go out of the house to be independent within
Yes.
quotes. And what they are achieving by the sea. I actually lived in UK and Canada for more than 12 years. And I came back to India straight on because I wanted to make sure that the children grow with their grandparents and make
I
sure,
agree.
yeah. And it goes without effort that the grandparents can mold the children to a very nice level. If you tell, they will not listen. The same thing grandparent tell, they will listen
They
actually.
listen.
So
I
this is
see
where
this.
we're going wrong now in India.
Yes,
And
yes.
the nannies can't do such things. So I think that's where we start, and we have the young heart attacks we are talking about. So we have to make sure healthy lifestyle, keep moving, eat healthy, sleep healthy, avoid all the unnecessary stresses in life. Stress is a bad thing. So people are always goal oriented. They want to earn money. They want to do everything quick. So the person as soon as he gets the salary, he's not happy with that. So
I
the
know.
happiness factor is not there. The father used to earn 400 rupees and he was a happy man. He used to sing in the toilet. He used to have a whistle when he comes home to meet my mother. But now who is
Yeah.
doing that actually? They come
No,
on
nobody.
with an angry face. Is the dinner ready? Is it what that? They want to sleep before getting on to the next job. And nobody is happy. I don't see. Our life should be like a song. It should be like a melodious tune actually. So we have to pace out the life. You have to take time to relax, less stress in life, make sure everything is falling in place. It will take time to earn actually. Don't rush and do things, and all these things lead on to a heart attack before 45, 30, 40. I'm seeing lots of people having heart problems.
Yes.
And so good parenting is important, and make sure you lead a healthy lifestyle.
I think good parenting should be like co-parenting.
Yeah,
Both the partners should be
yeah,
involved
yeah, absolutely,
to look after the child, give them good values, and help them grow because they are the future. We have
absolutely.
to look after them.
Yeah.
Doctor, also like hypertension has also commonly seen in like a lot of age groups. So, what precautions a hypertensive patient should take to avoid any unforeseen situation?
So high blood pressure is a silent killer. So high blood pressure produces no symptoms until it produces a stroke, like losing a limb. One side of the body is not working. High blood pressure, medications used for high blood pressure produces more symptoms compared to people not taking medications. People often tend to forget or conveniently avoid taking medications because once they take medications, they go a little slower. The BP is low. They have to make sure they pace out. But with blood pressure, they can go quick. They can do things. So people don't like taking medications for blood pressure. It's a
Yes.
the number of people who really follow medications is less than 50% in any of the studies in normal lifestyle also. So people often, when we check blood pressure in the clinic, they say, sir, just now I came in the traffic, just now I was rushing, I am a little anxious. Always they give an excuse. When I say, no sir, my blood pressure is normal, because even when I tell, sir, your heart is already a little damaged, it's little thicker because of your blood pressure, so probably it is a little fluctuating all the time, sir, so make sure you're pacing out. So those things, I think BP is a silent killer, and people should have regular checkups of blood pressure. Don't take it easy. So 140/90 is the highest number we are talking about, but most of the time it should be 120/80. So don't think, sir, today only little bit higher, sir, 150/100 today, sir. Yesterday it was normal. So that sort of things, excuses, I don't, agree with them actually. So that's one. Next is taking regular medications. You have to be compliant with medications. The compliance is not there. So that's second thing. Third is often they forget coming back to the doctor. One medication we start, it could produce some side effects, or it may not be enough at all. So we have to have regular monitoring with the doctor, make sure we are doing the right thing. The different ways blood pressure could be tackled. So all these things should be monitored, and side effects should be checked. Regular blood pressure, people on regular blood pressure pills should have regular blood checkups, make sure they're not producing any side effects, and make sure they are adequate for the patient. So all these things should be taken care of. Lifestyle wise, less stress, more yoga, less salt in the diet, and less saturated food, less trans fat diet, and all these things will help to reduce blood pressure.
Correct, doctor. I totally agree. Like, doctor, you mentioned that less than 50% people are compliant towards their prescribed medications. Often in my practice, when I ask, are you taking your medicines regularly? So people like, of course, marna thodi na hai. This is one side of people, and then there is one side of people. हाँ हमारा BP एक बार high हुआ था. Now it is normal.
Yeah,
So I'm
yeah,
not taking medicines. And the
yeah,
next question is like, did you ask your doctor that if you can stop your medicine? नहीं normal है तो क्यों पूछना है?
yeah,
क्यों जाए हम?
yeah,
I'm feeling good. They don't understand that if you want to start a medication or stop a medication, doctor is extremely important so that he can review that, okay, now you're safe to stop the medicine.
yeah, yeah.
When they land up in trouble, they want to go and catch hold doctor's collar. अरे आपने बोला था ठीक है अब क्या ये and all that. They don't
Yeah,
understand that you have to visit your doctor every 3 to 4 months, whether your blood pressure is in range or not in range or any other
yeah,
vital.
yeah, yeah,
It could be sugars as well, but please visit your doctor
yeah,
and then stop the medicine.
yeah. There's another fear is like once you start, you can't stop. That's another fear they
Exactly.
have. And if you go to the doctor, he's going to insist continuing it. Actually, that's another problem. It is not true. Once you make lifestyle modifications and your blood pressure is under good control, you can gradually withdraw your medications also. So those
Yes.
things, with the doctor's consent and supervision, it could be very safely done.
Yeah, you have to wean the medicine. You can't just
Yeah,
stop it overnight and then like, Are, I'm feeling okay. And then suddenly after 2 to 3 months or maybe a year later, there's a high spike in, any it could be like you mentioned, like a silent attack, and you're helpless. You can't do anything about it. So I think it's always better to stay in touch with your doctor.
yeah.
Yes. Doctor, with Ab Suno Dil Ki, we want to educate our viewers about practicing some essential habits like getting regular checkups and eating heart healthy food, no matter what the age is. What would you like to tell our viewers about the importance of Ab Suno Dil Ki?
So I would suggest have a master health checkup starting from a young age, especially if you have a family history of heart attacks. Then you start off even at 30 years to have a little checkup. Just make sure your sugar is okay, your cholesterol is okay, your BP is okay. Don't need to be obsessed about it. So that's another side of the coin. I'm seeing people are getting too much obsessed about their health. Even little pain, they think I am going to go. Some bad news
Yes.
on the TV, then I am the next victim. Especially all the stars dying suddenly, they get really panicky. And I tell, sir, if you keep coming in to see me like this, I'll build another house, sir, actually, without any effort. Why you're so much obsessed? So you lead a healthy lifestyle and you have to, have some confidence in your health. And that is another thing. So basically, I think start off early, do master health checkups, make sure you're healthy and lead a very, contented and stress-free life, which is the main thing. And make sure your risk factors are under control. So even if you start off a little medications under the doctor's supervision, just carry on if necessary, or you can stop it if it is not needed. Don't need to really worry about it. So little changes in your lifestyle, very important. And make sure you actually follow just simple rules in life. Eat healthy, keep moving, and lead a stress-free life. That is it.
Great, doctor. This is something what we really want our viewers to know. Doctor, I would also want you to answer one last question. You mentioned that stay away from trans fats and, saturated fats. So, where do we see this fat in which particular food? In our daily food, the dal, roti, rice, sabzi, is this the place where trans fat and saturated fat is, or where? Like, if I want you to answer this.
So this is a very commonly, the common problem we have actually. The how much of what oil should I use, doctor? How should I, cook daily? That is a good question to have. If you have anything takeaways, then often we don't know what is inside there. Actually, if you look at the packaged food, like a crisp packet is not good for you. So because it's actually deep fried, and that
Yes.
is not good. Donuts, for example, Dunkin' Donuts, with a cup of coffee, very bad for you. And you have samosa, all the puff items we're eating are not good for you. So because all the deep fried items not good for you. So those things, you don't need to be a saint from day one. Little bit is okay, but you should
Yeah.
not eat a plenty of them. Whenever there is anything tasty, then you try to limit it to the minimum. Even sweets with ghee, pure ghee sweets, 100% ghee sweets. Wow. No, yeah, by listening to it, I get really, the saliva coming out. So what you have to do is the same taste is in there if you eat the whole thing. So I would say cut the sweets into smaller portions and eat a little bit so that you don't miss them, but at the same time you don't eat it so that it's not producing a bad effect for you. So cut the sweets into smaller portions. When you have anything tasty, have a little bit rather than a lot, and those things would help you to moderate your amount of eat plenty of vegetables instead. Actually, that is, you have to reverse the portion sizes. So that's the other thing. So these are the practical tips. So trans fats and saturated fats in all the processed food, fried foods, readily available, pre-packed items, all those things you have to avoid. Red meat also you have to avoid
I
that.
agree. I
Yeah.
totally agree. Dr. Harikrishnan, this was quite an insightful session. We would really like to thank you for joining us and educating us on such an important topic and letting us know in a very simple way how important it is to listen to our heart. Um, we hope that this information, which was shared by Dr. Harikrishnan, was helpful and will motivate you to be cautious about your health. And I would like to thank everyone for watching this video. Do follow all these tips shared today to embark on your heart's good health journey. And we will be right back with another health from home session. Until then, stay safe and stay healthy.
So
Thank you so much, Doctor.
Vasundhara, excellent, complimenting me and being a nutritionist yourself. I think it was wonderful having spent some time with you. And likewise, I think I'm sure the audience would follow simple steps to keep their heart healthy. It's not rocket science. I think we have to try to become our forefathers like farmers and try to cultivate healthy habits in life. Sleep peacefully, eat healthy, move, don't sit in one place, and avoid risk factors right from young age, and so that you can maintain a healthy heart. Thank you very much.
That was great, Doctor. And I'm very happy to connect with you. It was really insightful. I have learned so much. And whatever challenges I have in my daily consultation, you have solved them. And I hope our viewers benefit from the same. And thank you so much, Doctor.
Thank you very much. So sweet of you. Thank you. Bye.
Thank you.
Bye.
Thank you,
Take care.
Doctor.
Bye. Bye.
Yes.
Thanks.